Today, we'll be discussing practical applications of classical conditioning. So, what relevance does classical conditioning have in our everyday lives? And the first way we use classical conditioning is to understand phobias. So, we know that a conditioned fear response can be elicited by a previously neutral stimulus that has been associated with an aversive stimulus. So you take a neutral stimulus like a dog, associated with an unconditioned stimulus like a bite, and you develop a conditioned fear response to the dog. Take a neutral stimulus like a bird, pair it with being attacked, and you develop a conditioned fear response to the bird. Now, this is usually adaptive because it motivates us to avoid dangerous situations. Remember, classical conditioning deals with involuntary responses. So because you've been bitten by a dog, you develop an involuntary conditioned fear response to that dog. And because you feel fear whenever you're around dogs, you develop the behavior to avoid that dog, avoid the dangerous situation. Again, this is usually adaptive. It helps us survive. It helps us avoid dangerous situations. However, this fear response can become exaggerated and the fears can become overgeneralized. So instead of just fearing the dog that attacked you or the breed of dog that attacked you, you might fear all dogs. So you fear Yorkshire Terriers and Chihuahuas and other small dogs that really pose no threat to you, but because your fear is overgeneralized, it's reached the level of a phobia and you fear all dogs equally. Or if you were, attacked by some type of large bird, you not only fear that type of bird, but you fear birds and finches and all types of birds that, don't pose a threat to you. And so you have overgeneralized your fear and you have developed a phobia. Now, typically the example that's used in psychology to illustrate a phobia is the little Albert experiment. And in this experiment, little Albert, who was an infant who was about 10 months old, was taught to fear a white mouse. Now, before this experiment, the mouse was a neutral stimulus. Little Albert had no fear of the mouse, but the experimenters paired the mouse with a loud song, a loud sound like a banging. So when little Albert would be presented with the mouse, the experimenters would bang things together behind him, startle him, and over time, through pairing the loud banging with the presentation of the mouse, little Albert started to show a fear response to the mouse. Not only did he develop a fear of the mouse, but he generalized that fear to other things that were similar to the mouse. So he began to show a fear of fluffy rabbits that looked similar to the mouse. He also started showing a fear of like a Santa Claus beard that was fluffy and white like the mouse. So because he generalized his fears, the experimenters concluded that little Albert had developed a phobia as a result of his conditioning. But there are a few aspects of this experiment that make us really question whether or not little Albert truly developed a phobia. The first thing that brings this conclusion into question is the fact that the neutral stimulus of the white mouse and the unconditioned stimulus of the king had to be paired together many times before Albert exhibited this quote unquote phobia. We know in real life, sometimes a single pairing of the NS and the US can result in a phobia. So you can be bitten by a dog one time and develop a phobia of dogs. You can fly on a plane one time and have lots of turbulence and develop a phobia of flying. So typically, it does not take repeated pairings of the NS and the US for a phobia to develop, but in little Albert's case, it did take repeated pairings. Little Albert's fear reactions also diminished greatly after a 30-day rest period. So when he went 30 days without being exposed to the mouse, the Santa Claus mask, the bunny, anything he had generalized his fear to, in that 30 days, his conditioned response of fear diminished. Now we know in reality when a person has a phobia and they avoid the thing they have a fear of, that conditioned response of fear tends to intensify. It tends to strengthen because they have not been exposed to the things that they fear. And the exact opposite happened in Albert's case. Not being exposed to the things that he had the quote unquote phobia of reduces his fear response. Also, little Albert displayed no fear when he was able to suck his thumb. So he was able to, on his own, figure out a way to soothe himself. And when he did this, his phobia, completely disappeared and he showed no fear. Again, we know this does not typically happen with real life phobias. And so now we think that it is unlikely that Albert developed a true phobia as we see outside of the lab. And so now it's concluded that Albert likely did not have the type of temperament that led to phobic reactions. And we've discussed previously the types of temperaments that tend to lead people to condition more easily and develop more of these type reactions. And Albert most likely did not have that type of temperament. So that leads us to ask, why do some people develop phobias and others don't? And so there are a few things that can lead to phobias being developed in certain situations and not in others. And one of those things is observational learning. So oftentimes in my classes, I'll have students say, I have a fear of dogs, but I've never been bitten by a dog. I've never been attacked by a dog or chased by a dog. So how can my fear of dogs be the result of classical conditioning or the result of learning if I've never had an aversive experience with a dog? Or I've never been involved in any type of negative experience on a plane, but I have a fear of planes. I've never almost drowned, but I have a fear of water. So if I've had no type of learning associated with these experiences, how do I possibly have a phobia of them? And one explanation could be observational learning. So in this case, phobias are acquired by observing fearful reactions in others. So the display of fear in others can be an unconditioned stimulus that results in the unconditioned response of fear in oneself. So take a neutral stimulus like a snake. You see someone display a fear of the snakes. So their display of fear becomes an unconditioned stimulus that brings about the unconditioned response of fear in yourself, or fear in oneself. So as a result, snakes become a conditioned stimulus that bring about fear in oneself. And you see this oftentimes with children and parents. Children are so keyed into their parents' emotions. The parent might see a dog. The parent is afraid of the dog. The parent shows fear. And the child's natural reaction to seeing their parent afraid is for them to become afraid. And so now they develop a fear of dogs. And the U.S. was not an attack. It was not being bitten by a dog, but the U.S. was seeing their parent show fear of the dog. So phobias can be developed through observational learning. Something else, as we've discussed, that can lead one person to develop a phobia and another person not to develop a phobia is their temperament. We discussed this last week in terms of Pavlov's and Isaac's theory of personality. And that theory says that an individual's genetically determined level of emotionality and reactivity to stimuli affect how easily a conditioned response can be acquired. So your natural genetic level of emotionality and reactivity to things in your environment can determine how easily you condition, how easily you develop phobias. And as we know, introverts tend to condition more easily and extroverts tend to condition less easily. So two people can be exposed to the same pairing of an NS and a US, and based on their temperament, one person might develop a conditioned fear response to that stimulus and another person may not. Something else that can influence whether or not a phobia is developed is preparedness. And this says that organisms are genetically predisposed to learn certain kinds of associations more easily than others. For example, fear is easily conditioned to animals and insects, and fear is less easily conditioned to inanimate objects. And so if you think in terms of evolution and survival, it makes sense for you to be more easily conditioned to fear an animal or an insect because those things can pose a threat to you. They can harm you. So it makes sense that if an animal or an insect is paired with something aversive, that you will learn to fear that animal or insect. You take something inanimate, take a pair of sunglasses, you take a balloon. Those things really don't have the ability to hurt you, so you are less likely to develop a fear of those things if they are paired with something aversive. So let's take an experiment. Let's take the little Albert experiment. He was shown a mouse and had a loud sound bang behind him. And so he developed a fear of the mouse. He would be much less likely to develop that same fear if they showed him a toy truck and then banged a loud sound behind him. Because we know that the truck does not pose much of a threat, so it's more difficult to condition a fear to those types of inanimate objects. You're much more likely to develop a fear of a living object if it's paired with something aversive. Another example is nausea is easily conditioned to food rather than a lighter tone. So let's say you have somebody eat a certain food and you give them a dose of medicine that makes them feel nauseous. They are more likely to develop a conditioned response of nausea to the food than if you were to shine a light or sound a tone and then give them the same medication that induced nausea. They will be much less likely to develop a nausea response to the light or the tone than they would to the food. And so the idea is that we are already prepared to make certain associations. So we're more prepared to associate feelings of nausea with the food than something like a light or a tone that is unlikely to be prepared or be paired with nausea, in real life situations outside of the lab. Something else that can contribute to the development of phobias is incubation. And this is the strengthening of a conditioned fear response as a result of brief exposure to the aversive conditioned stimulus. So when people have a phobia, they typically avoid the conditioned stimulus altogether or expose themselves to it for a very brief period of time. Okay, so um, often people will say things like, you say that you extinguish a conditioned response by exposing yourself to the conditioned stimulus without the unconditioned stimulus. I've tried to do this and it didn't work. So they'll say things like, I went around dogs, but I still have a fear of dogs. And so I'll ask them things like, tell me about when you went around dogs, what happened? Oh, well, I went to my friend's house. They had a dog. I saw her dog. I stayed for a couple of minutes and I left. So my response would be, you didn't stay around the dog long enough. So remember that the way extinction works is you have to stay around the conditioned stimulus long enough to know that the unconditioned stimulus is not going to happen. So you have to stay around the dog long enough to be sure that the dog won't bite you, to be sure that the unconditioned stimulus won't happen. If you're afraid of snakes, you can't walk in, see a snake, and leave and say, well, I tried extinction. I went around the CS without the US, and I still fear snakes. You have to stay around the snake long enough to see that the snake is not going to bite you, or to see that whatever US you fear is going to occur will not occur. If you briefly expose yourself to the aversive CS and don't stay around it long enough to see that the US is not coming, then incubation will occur. You never get to see that the US is not present. In this case, your phobic reaction increases. Conditioned response, that thing you fear, increases. And again, we can never know what's going on inside a person's mind, but most likely what's happening is if you stay around a dog briefly and leave, stay around a snake briefly and leave, and never have that time to see that the unconditioned stimulus is not present, you're likely to be telling yourself, if I had stayed longer, this dog would have bitten me. If I had stayed there, the snake would have attacked me. And so you have to stay there long enough to see that that thing is not coming. And once you stay there long enough, extinction will occur and the fear will diminish. But this is typically not what people do when faced with something that they have a phobia of. Now, I realize, I just left out one thing that can also contribute to the development of phobias, and that is US revaluation. And we talked about that last week. And we know that you have a conditioned response that is a result of having a neutral stimulus paired with an unconditioned stimulus of a certain strength, and being exposed to an unconditioned stimulus of a different strength can change your conditioned response. So sometimes people develop a phobia through US revaluation because they've been exposed to a US of a higher strength than was paired with that neutral stimulus, and they react to that neutral stimulus once it becomes a conditioned stimulus with that elevated elevated response because they've been exposed to a US of a higher strength. So again, US revaluation is another factor that can influence the development of a phobia. Okay, so how do we treat phobias? And so one way of treating a phobia is through systematic desensitization. And systematic desensitization is based on the idea of counter conditioning. So a conditioned stimulus that elicits a certain type of response is paired with something that elicits an incompatible response. So you're pairing two things that bring about different responses. So you take whatever response your conditioned stimulus brings about, and you pair that with another stimulus that brings about an incompatible, a different response. And so this brings about reciprocal inhibition. So certain responses are incompatible with each other, and the occurrence of one response automatically inhibits the other. So this is pairing two things that bring about different responses, and because those two things bring about different responses, they kind of cancel each other out. So you'll see things like an example would be if you have to give somebody bad news and you bring them a gift or bring them flowers. So the idea is, I have to give you bad news. This is going to make you feel bad, but I bring you this thing that makes you feel happy, and those two things will cancel each other out. So you're going to be less mad at me when I get this bad news if I bring you a gift. So you're combining two stimuli that bring about different responses, and those two things cancel each other out. And systematic desensitization is very good for people who have very specific phobias. So if you fear something specific like, heights or snakes or mice or enclosed spaces, this is a good treatment for you. It's less effective for people who have more general fears. So things like social phobias. If you have fears of social situations, that can be public speaking, that can be socializing with people at parties, that can be, any number of social situations. So systematic desensitization is really not the appropriate treatment for those types of more general phobias. It's more appropriate for people who have something in particular that they fear. So these are the steps to systematic desensitization. So remember, this is based on counter conditioning, the pairing of a stimulus that elicits a certain response with the stimulus that elicits a different response. So in this example, you're taking a stimulus that elicits fear and you're pairing it with relaxation, so an opposite response. So the first step of systematic desensitization is to train the patient or the subject in relaxation. And you can do this in a few different ways. It can be deep muscle relaxation, where you're teaching them how to relax the muscles of their bodies. It can be visualization, where you're having them, visualize something they find calming, something they find relaxing. It can also be something like meditation or hypnosis. So whichever method you use, your first step is to teach the person how to relax themselves. So once they're able to effectively use one of these methods to induce relaxation, then you have them create a hierarchy of imaginary scenes that elicit a progressively intense level of fear. So this means, let's say they have a fear of, let's take snakes again. So you're going to develop a hierarchy, and you have them say the lowest level of being exposed to a snake that produces fear. So the thing that produces the lowest amount of fear might be hearing people talk about snakes. Okay. What produces a slightly higher level of fear? Could be looking at a picture of a snake. Then the next level of fear might be seeing a snake on TV. The next level of fear might be seeing a snake in the same room in an enclosure across the room. Then it might be seeing a snake in an enclosure close to me. There may be a snake outside of an enclosure across the room. Next level of fear would be seeing a snake outside the enclosure close to me, and my ultimate fear might be having a snake touch me. So you have them create that hierarchy going from the lowest level of fear to the highest level of fear. And the reason that you have them learn the relaxation before creating that hierarchy is that just talking about it, just creating that hierarchy can bring about a lot of fear, a lot of anxiety. So you want them to have the skills to relax themselves before they even start developing this hierarchy. So once they've learned to relax themselves, you have them develop this hierarchy, then you begin the exposure therapy. So you're going to pair each item in that hierarchy with relaxation. So you start by having them use their, hypnosis or meditation or visualization, whichever technique they've learned to relax themselves. They start using that technique until they're relaxed, and then you expose them to the first level of their hierarchy. So if the first level is talking about snakes, you begin talking about snakes while they try to maintain that level of relaxation. So once they get to the point where you're talking about snakes and they're able to stay relaxed, then you introduce that next level in the hierarchy. So then maybe you show them a picture of a snake and they use their relaxation technique to stay calm until they're able to look at the snake or look at the picture of the snake and stay relaxed. And then you might show them a snake on TV. They use a relaxation technique to stay relaxed. And you work up this hierarchy until ultimately they are so, experienced in keeping themselves relaxed, and they've built up such a tolerance to the imagery or the presentation of it that ultimately, if their highest fear was that you touch them with the snake, they're able to remain relaxed while they are touched by a snake. So this is counter conditioning the idea that you're pairing the snake, which brings about a phobia, brings about anxiety, but you're pairing that with relaxation, and relaxation and anxiety cannot coexist at the same time. So they're able to fight the anxiety, fight the phobia through their relaxation technique. Systematic desensitization can be imaginal or in vivo. With imaginal, the exposure to the phobic stimulus is imaginary. So this could be the person just imagining a snake near them, imagining a snake touching them. So they're not actually exposed to it, but they are, coached to have very vivid imagery where they're imagining being exposed to the thing that they fear. In vivo, the exposure to the phobic stimulus is real. So in this case, the therapist would have to actually bring in a snake or bring in the thing that they fear and go through those various steps until ultimately they would actually have to experience having a snake on them or having, a on their face. If that's the highest level of their fear hierarchy, they would have to actually have that thing happen in real life as part of their therapy. Now, before I move on, one thing about the in vivo therapy is, of course, this might be counterindicated if the thing they fear is something that's actually dangerous. I mean, of course, if a person is afraid of their ultimate fear is being involved in a plane crash, you wouldn't expose them in vivo to a plane crash. In that case, something like imaginal exposure would be more appropriate. Okay, another way of treating phobias is through flooding. And flooding is prolonged exposure to a feared stimulus, thereby providing maximal opportunity for the conditioned fear response to be extinguished. And flooding is based purely on extinction rather than counter conditioning. So this is based on exposure to the CS without the US being present. So there's no pairing with relaxation. There's no counter conditioning where you're trying to pair two things that bring about differing responses. This is purely exposure to the thing that you have a phobia of without the unconditioned stimulus or the thing that you fear happening actually happening. And there's no building up. There's no starting at the lowest level of your hierarchy and working up. This is whatever you fear the most. If what you fear is having a spider placed on your face, your therapist brings you in and they place a spider on your face. That would be flooding. And so often students will say things like, "Oh, I couldn't deal with that. I would pass out." And I would say, "Okay, therapist puts the spider on your face. You pass out. You come to, and the spider is still on your face." And so the idea is that whatever you fear is going to happen, the spider attacking you, the spider biting you, it doesn't happen. And we know that our bodies can only maintain arousal for so long. You can only stay fearful for so long. Your body gets exhausted and eventually you calm down. So If you have a spider on your face, you might scream, you might yell, you might cry, you might actually pass out, you come to, and eventually your body just purely physiologically will calm down and you'll see, I thought I was going to die. I thought the spider was going to attack me. I thought all these horrible things were going to happen, and actually they didn't. And you have extinguished your fear response. Now, as it sounds like, flooding can cause a great deal of stress, so it's not appropriate for people with a history of other psychiatric or medical problems. You have somebody who is, for instance, schizophrenic and has hallucinations. Something like this would cause them too much stress for it to be an appropriate intervention. If a person has medical problems, has heart problems, has other issues that put them in a high risk category, you wouldn't want to use something like flooding that exposes them to such a high level of aversive stimulus. It would not be appropriate. And just like systematic desensitization, flooding can be done imaginal, so it'd be done using your imagination, or it can be in vivo, be done in real life. So that would involve things like, if you have a fear of heights, we take you to the top of a high building. That would be in vivo, as opposed to you just imagining being on the top floor of a very high building. Another way of treating phobias is through modeling. This type of therapy is also called participant modeling, contact desensitization, or guided participation. And here the therapist models interacting with the phobic stimulus for the client. So just like it sounds, modeling, the therapist will first touch the object alone. So my client has a fear of spiders. First, I'll touch the spider, show them that I'm able to touch it without fear. Nothing happens. The spider doesn't bite me. The spider doesn't attack me. And then I might touch the spider with my client. So we do it together. And so I act as a model, remaining calm while we touch the feared object together. And then finally, I encourage the client to touch the spider on their own. So they've seen me do it, we've done it together, and then they expose themselves, or they touch the feared stimulus on their own. So far, we have been talking about eliminating phobias, about eliminating conditioned fear responses. But what if you want to eliminate a response to something that you have an attraction to? How do you eliminate a problem behavior based upon being overly attractive or attracted to a particular stimulus? So in this case, we use aversion therapy. And this is a treatment procedure that reduces the attractiveness of an event by associating it with an aversive stimulus. So how do you stop liking something that you like? Or stop being drawn to something that you're drawn to? And examples of aversion therapy would be, for example, sometimes with alcoholics, they'll have them take every morning a pill that causes them to be nauseous if they then consume alcohol after taking the pill. So you pair the thing that the person is attracted to with an aversive stimulus, and they begin to lose their attractiveness or their attraction to the stimulus. And this is a form of counter conditioning, like we talked about with systematic desensitization, but it's in the opposite direction. You take something that a person is attracted to, pair it with something aversive. Those two things cannot exist together, and so they lose attraction to that first stimulus. Another example is using shock therapy for pedophiles. So you take a person who is attracted to underage children, you pair images of underage children with a shock. So those two things, induce opposite responses, and they develop an aversion, in theory, to these images of young children. And we have our example here of a person who touches chocolate cake. They receive the aversive stimulus of a shock, and then they develop an aversion to the chocolate cake. So this shows you how classical conditioning can be used to treat phobias as well as to treat problem behaviors.